Mental health partnerships in education, as we focus on student learning, need to take a look at mental health and how it impacts their success. We want to be addressing barriers and challenges. What are some of the strategies we can use as we continue to look at their academic growth? Some of the sessions today are going to be talking about what are some strategies we can use? How can we identify and refer? How do we support and educate while they're managing and trying to cope with mental health issues? And the other thing is, lots of times in education, we go, geez, what are we going to do next? How are we supposed to handle all these challenges? And sometimes it feels like the weight of the world is on our shoulders. We have mental health partners in our community that can help, that can support. And the more we communicate, the more we collaborate, the more we work as a team with our community partners, the better we're going to be able to serve our students.
Talk about what the school-linked mental health grant will provide for the student and you as the teachers and other professionals within Detroit Lakes Public Schools. Some of our partners, you can just look through them: Becker County Social Services, schools within Becker County, Stellar, Lakeland, Lutheran Social Services Village, and Sanford. Hopefully get them involved as well. Some of our goals that we have, one is to look at certain areas that are needed for students, and one of the areas we focused on is child psychiatry. A second area is the uninsured or underinsured. Those are those children, for whatever reason, are not able to have services because their insurance does not provide a community mental health service. The last piece I'm going to talk about, and I'm going very quickly here, but that's good, coordination. One of the discussions when we were talking was how there seems to be a lack of coordination with the right hand and the left hand on knowing what we're doing with these kids. Teachers go down a path, mental health providers go down another path. Not everybody's knowing where to go with that. And we put a piece within that school-linked mental health grant to actually have that option for the clinician, mental health professional, the mental health practitioner, those people that are involved with these kids outside this school or within the school to come to such things as IEP meetings, come to after school to connect with the teacher to talk about what's going on. That's all part of this service to access that.
Another big part of the school-linked grant is training, but it's to provide different types of trainings to school staff to help either work on behavior management or understand mental health behaviors or diagnosis. Part of that is to develop a common language. I think when we have kids that are really struggling through whatever they're going through, and we have 6 different people using different approaches, it makes it really difficult for the child. And so we try to really work on developing a common language, having the same approach, so that you or I can meet a child in the hallway and still manage it in the same way. What studies are showing is that up to 25% of kids can technically be labeled with opposition defiant disorder. Those kids that really have a hard time displaying aggression, they're disruptive, hyperactive, the kids that can cause some difficult problems in your classroom and impede on learning. Just kind of some of the things that we're hoping to help support is definitely increasing proactive teaching strategies, providing positive discipline, and focusing on social and emotional competence.
Well, good morning. I'm Don James, and I'm a supervisor at Becker County Human Services.
Hi, I'm Colleen Beck, and I work for Stellar Human Services, and I'm presenting on students and trauma this morning.
Hi, I'm Dave Erickson with Stellar Human Services.
I'm Dr. Charlotte Andersen, psychiatrist at Prairie St. John Lake Gas. I'm a therapist at Solutions, and I'll be doing anxiety.
And Joel Bakken and Solutions, and I'll be presenting on life skills processing.
Amber Nelson with Becker County Human Services, and I'll be presenting on the crisis program here in Becker County.
Marty with Solutions Behavioral. I was on the planning committee, and I'll also be the coordinator of the referral process.
My name is Mary Lewis. I work for Lakeland Mental Health Center, and I was in the planning committee.
Sarah Jaskin from White Earth Tribal Mental Health.
Good morning, Angela Belanger, and I work at White Earth Tribal Mental Health as well.
I am Paula Dietz.
Sarah Jensen, Fritz.
We're school psychologists for the district.
He talks about the left brain and the right brain. The right brain controls emotional stuff, and the left brain is our logical part. And he said when people, especially kids, he was writing about kids, you know, they tend to get stuck more easily than we do in that right brain. Their emotion, they're running high, they don't know they haven't developed their logical part yet. So they get stuck, and we see that. He gave the example of this kid. It was bedtime, the child went to bed, I think he was 6 or 7, he came out, and he just had an emotional meltdown in front of his mom. He said, you know, you don't like me, you like younger brother more than you like me, my teacher's stupid, everybody hates me. And she's thinking one of two things, that either he's trying to stall and not have that, or he really is an emotional mess. And kind of our first reaction when that happens is to try and be rational and say, I don't know what you're talking about. What evidence do you have that I hate you?
The assessments that we should have available to you by the end is you should have a psychiatric assessment that tells you what we've done with their medications, and that's clearly available if somebody knows to get it to you. And I would say, I've already heard where something kind of fell through the cracks. You guys, please, that's what I'm here to say, is I want you to have that. I mean, for all the good I can do any child, the truth is I don't do much good unless their family and you all know what it is that I'm trying to do. I mean, truthfully. And so I want you to have that information. So when we sign a release and that child is discharged, within some fairly reasonable period of time, you should be getting that documentation. If you have a child with us and you aren't getting it, please call. And that's because then we need somebody to track that. I want you to have it. Otherwise, what did you gain by having your child come to us?
If you ask them what happened instead of why did you do that, what if they start blaming right away? Do you let them just...
That's when you look at the disruptive factor. And often I might stop them at that point. This isn't going anywhere. And give them, hey, I'll come back in a couple minutes when you're ready to talk. That might happen a few times. Okay? Yeah, you might have to wait for a while. How long have I waited with people? Anyone want to guess?
Days.
Yeah, you're right when you go days. I've waited somebody 18 days once. And you're going, what? How did you pull that off? Well, it was a FAS, fetal alcohol syndrome, 10-year-old girl who had a history of people that tried to do behavior plans with her, and said, got to a point she would escalate, and then they'd say, this isn't working, and they'd give up. So all they taught her was to escalate to another level. And so she was pretty much good. She was really good at getting stuck and putting it to the next level.
We should expect it and try to get them to be on time and tell them, this is what we have to do here.
Right. Just maybe recognizing that that's kind of a new skill, basically. And a lot of times I think you're dealing with kids learning how to live in two different worlds, because they come here at school and they need to be, you have 3 minutes during passing time, you need to get your books in your locker, you need to go to the bathroom, get a drink, and get in that classroom, all in that time. Whereas home, it's, you wake up when you're not tired anymore, and then it's time to go out and collect sage in the morning, and then you're hungry, so you eat, and then, it gets dark, so it's time for sleep, versus those kinds of time patterns. Because for a lot of kids, it's difficult to walk. We've had presentations on walking in two worlds, because literally that's what you're expecting them to do and asking of them. At home, they can act this certain way, versus if they come to school, they need to act this certain way. So really, you're asking them to be two people. And then they really find, and they struggle as far as who they are.
The next thing you see is feelings of worthlessness or guilt. Kids may talk about running away from home. My parents don't love me, nobody would care. The world would be better if I wasn't here. Those kinds of statements, we hear those on a very regular basis. They may overreact to failure or disappointment, so they don't do well on one test, and all of a sudden, I'm a poor student, I'm gonna quit school, I'm gonna drop out, I can't do it. So it's one little thing that's magnified into a much larger deal. And then chronic low self-esteem. So what's specific to one domain, that kid that struggles in math might expand that to the fact that they can't do anything. I hate school, I can't do school, I'm not gonna try. And unfortunately, what we say oftentimes becomes self-fulfilling prophecies, so we'll see kids who really started out as not such bad students all of a sudden becoming kids that are struggling in the school setting. And then last but not least, oftentimes kids with depression will have ongoing thoughts of death or suicide. So if all of a sudden you've got a student who comes in and they want to talk about someone in their life that's passed away, that maybe the death was a while ago, and all of a sudden they're bringing it up, or they're really focused on the thought of death or the thought of dying, that's a clue that might be worthwhile to refer them for an assessment.
For every crisis call, there's 14 days of stabilization, but they can call in as many times. If there's a family, I mean, we've had some families who we went out 5 times and we keep saying, here's, mental health services, and here's, an ongoing, rather than always having to be in crisis mode. And they'll, the parents will say, no, don't need it, don't want it, but then they're calling in the next week. So we start our stabilization 14 days over, and we just continue to encourage. And we have definitely had families where nope, and then finally the 4th or 5th time they'll say, okay.
I realize that you
were this last quarter. I think we had like 75 calls. 50 of them were adults, and then the other ones were children, and we went out 40 times. So
the average child call that we're getting is that 12 to 18. That real, and a lot of it's behavioral, a lot of it's that parent-child conflict. School.
About when we're talking about trauma within kids is how important your guys' role, teachers and mental health workers together, help us assess and diagnose kids. I'm a mental health professional and I do diagnostic assessments, so I'm one of the people that would talk to a teacher, talk to the parents, interview the child, to try and come up with the best mental health diagnosis to help them get through their issues. The problem with kids that have experienced trauma is they often look like other mental health disorders, because kids that have experienced trauma can look like an ADHD kid, they can look depressed, they can look anxious, they can look all of the above. And with older kids, high school, junior high kids, a lot of times they have a hard time with that too, because they're more aware of like societal norms and stuff, and I think sometimes they're afraid, they think that they should be able to just get over it and move on.
Anxiety disorder is fears or worries that are uncontrollable and happen pretty much on a daily basis. When their fear or their anxiety sets in, everything else goes out the window. And no matter how important that math paper is to them, when they're in fight or flight survival mode, they're gonna fight you to the nail to get it done with. And again, kids will always find someone that they feel safe with. And I think about my 6-year-old, the first day of kindergarten, he was really close to me. He certainly went, but it would be very appropriate for him to be anxious and close to me the first day. 4 months later, it wouldn't be very appropriate. And so thinking about that's when anxiety disorder kind of comes in.
Self-regulated kids not only follow directions better, they also learn better because they're calmer, they're more available to your teaching. Their energy can be spent on learning, following directions, and not on thinking about their own needs, meeting their own kinds of needs with that. So what do we do to help sustain that regulation? If they come in calm, we want to keep them calm. What else do we do to promote keeping them calm and self-regulated? One of the most common sense thing to do is just have a predictable routine. And I think most people already know that. If you have some kind of routine structure that they can count on what's going to happen next. What do you do this? What do you do next? Often these kids come from unpredictable environments. One of the parts of using predictable languages is using something that we call effective commands. And that is when you want somebody to do something, you give an effective command. And effective commands are short, direct, and very specific. They give a clear description of exactly what you want the kid to do.
Hello, my name is Joel Bakken. I'm with Solutions Behavioral Healthcare Professionals. I'm the Executive Director here, and I get the opportunity now to talk about School-Linked Mental Health Services. School-Linked Mental Health Services is a grant that we received, this area, Becker County and Detroit Lakes, to provide mental health services in the school, but also to coordinate those mental health services with with teachers and other school personnel. And that's our primary goal. We're excited about that. The service has been available here since 2007, and we are now moving on to the next 2 years. We're excited to provide a number of components that we haven't offered before. First off, let me talk about the coordination piece. The coordination piece allows teachers to talk with mental health providers, mental health services, after school, during school, and get those folks involved with the services, and that's really exciting. We're hoping to have that service utilized 1 to 2 hours a month for a number of people. The second component, which I want to talk about briefly, is to provide mental health services for those students that are uninsured, so that the family has no insurance, and those that are underinsured. And those are students with insurance, but for whatever reason, that insurance does not provide the mental health service that is needed for these people. A third component that you obviously just saw some of it is the training component. We're hoping to have trainings go on not only in your school but in other schools in the area, so we again can get the services coordinated and also similar, so when the mental health provider comes in and works with a student, that the language and other things that we use is really similar, so everyone's on the same page with that student. Essentially that there's not two different interventions going on. And the last component is talking about how do we get child psychiatry. Child psychiatry is probably one of the more difficult services to get access in this area. And we're lucky enough to have a psychiatrist available through ITV and other services to coordinate, consult with cases, consult on general topics within Detroit Lakes Public Schools. All these things are really excited. Hopefully you'll get an opportunity to utilize this, and thank you for taking a few minutes to listen to me here.